morning, Barbados. Saturday morning, 9 o'clock. 9:01 actually, and VOB every Saturday. 99:30 we bring you tips and health and living and what life is about. So we're about living today, and first of all, say morning to you. And I didn't hear a high back, but I know you sing it right there. The nation, it's a new year and we're moving along, guys, and every day is a challenge. So you're driving, you're in your home, wherever you are, you're on the internet. The doc is here to you on this day, and we're gonna talk about men. We talk about women so many times. And male menopause, interesting. You never thought there was something like that, huh? I'm gonna take a few calls from you today. 434-1771, 434-1791, 434-1790. And you told the doctor, let's discuss to the nation. What do you think? What are your thoughts? Male menopause. You know, but female menopause. So I'll give you a little bit of brush up on that, and then we'll move to the male counterpart. Does it really exist? Is that really a myth? We'll talk about that. Lively up yourself, and I'll be right back. Alright, so I want to express my condolences to the Corbin family, Omari and others, and going through a tough time. Today is a day for you, but we just be comforted to know that we'll meet Pops again sometime. So, living and dying, we live. I walk through the valley of the shadow of death. You know that Psalm 91 that talks about, the Lord will lead you. He puts you in the green pastures, the still waters, and then he restores your soul and he gets you up, and then he leadeth you in the paths of righteousness. You see how he's taking you? Then you sit down, and he sit down in the midst of your enemies, and he anoints your head with oil. So it tells you, he suits you down, he guides you, you walk. And even the evil, he'll take you through all of that. If you evaluate that, Psalm 91, sit down and read it one day. You see, it's really nice. But that's life. Starting as a baby and moving on to the morphology, and as you get wiser and you move on to the end. But when is the end? We don't know. We're talking about menopause today, and we'll take some of your calls. I mean, some guys, we men, we don't even know what we want. You got your nice young lady in your early 20s and 30s, and she's having her monthly periods where you have the shedding of the uterus and blood is emitted because ovulation occurs monthly, and you're born with 500 eggs, and every month you give one off, and then when that's done, a lot of estrogen release and progesterone stops the whole thing, and then if there's no fertilization, then you have the shedding of the blood. That's the whole system right there in a short nutshell. 500 eggs, so think about it, 12 into 500 is somewhere 448, and 2, that's 12, and 12, almost 24, so it's somewhere around 52. So menopause normally is between 42 and 54, depends on which book you're reading, but normally I say 52 years plus or minus 4 years. But there are a lot of things that can cause you to have premature menopause. But I was talking about males. You sometimes you have a fiancée and you don't really appreciate this interruption of her, the cycle interrupting the whole process, romance and all those things. And you get disturbed. But when she goes and she would have a hysterectomy where they take the ovaries out, you're upset. You don't find her very sexy. I don't understand that. We people, we don't know what we want in life. You got something nice outside, looks better, and all those type of things. And then you got a part when a woman's in her menopausal years now. She's premenopausal or menopausal or postmenopausal. And then you find a man that says, you lose your womanhood and don't feel them all of those things. I think it's in the mind. Everything starts right up there. What are your thoughts about that? How you feel about that? But women go through a lot because in that era, you know, the estrogen levels are decreased considerably, and eventually when you have menopause really is when you have no more periods. So, no more estrogen. So you start to have symptoms, all these flushing and irritability and so forth, you know. So, that's the female part. How about the male part? Yes, there's a male menopause, or andropause, they want to call it. I'll tell you about that because a lot of you guys think that, no, we lose in the end. Women they win all the time, I think. But we'll talk a little about that. Some of the symptoms of andropause, or male menopause. Very interesting topic. People don't believe in it, but it is there. And express yourself. Charles Wright, and got a hip-hop made of, Ice-T did a portion of this, and this is I love this song. You know, call me back, express what you feel. You got a boss who is telling you things that you should do, and you, yes, 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 sir. Why? Why can't you stand up and say, boss, yes, in all due respect, but you think that this may be an option? Why not? They appreciate that. Most would. So, always express how you feel, not in a derogatory manner, but in a nice, soft answer. Turn it away wrath and so forth. So, yes, always feel free to say what you feel. It may not be correct, or it may be correct, or it may be, plus or minus. Whatever you feel is good to say in your children when they're growing up, if they're free to express themselves in a nice, humble way. Encourage it. Express yourself by the Gotta Hip Crew, and I'll be right back. Yeah. This is what you look like, baby. What do you want to do? Just do it. And express yourself. That's, what I tell you, Charles Wright. They got a hip-hop, but Charles Wright, guy that originated that song, the 103rd band in Harlem, New York. So, we're talking about female menopause and all the symptoms they'll have. Remember, there's some things you can do that would basically give you premature menopause, like smoking. People who are obese and heavy or have weight problems normally have early menopause. And certain illnesses like hypothyroidism and some other illnesses, chronic illnesses, can really cause premature menopause. Well, then, of course, there's a surgical one where you remove your ovaries and no more estrogen, of course. But also, people can have hysterectomy where the uterus is removed, but the ovaries are intact. You're not menopausal then, but eventually what will happen, as your levels go down, that's what happens. It's a slow process. But what normally happens, people will miss a couple of periods, and then eventually, if you miss it for 1 year, that's menopause. That's by definition. Now, why don't we move towards the other aspect, male menopause. You don't believe that can happen? Well, if female hormones, the estrogen, male hormones, androgen. So, if you will expect, as you get older, the levels to decrease. So as your androgens decrease, you experience some of those symptoms too, a little bit of irritability, depression, and all those type of feelings you start to have, and also infertility and sexual dysfunction. And that's another topic. I know you guys like to hear about that, and how you can alleviate that. Viagra and Cialis and all those guys have really changed up the way men live these days. Long ago, you have diabetes and so forth, and you have sexual dysfunction or erectile dysfunction, man. I mean, it was like crazy. It caused men to do some serious depressing things. But now there's help, but of course, you have to see a doctor. They'll advise you. But yes, so as you grow older, your testosterone level will decrease. And in decreasing, what happens is that, you have some of these symptoms and so forth, and also infertility. fertility, and so. But men really should produce sperms until their 80s and so forth. But some illnesses, as we mentioned with the females, can really make that premature and have you to have, give you all of these symptoms and so. Well, yes, so I say now on television, on radio, that there is something called male menopause also. Some people call it andropause and so forth because of androgens and so forth. So there's therapy for it, but you may wanna, if you're in an age where you find that you're irritable and you find that you don't have a desire for sex and you find that you're having some issues with ED or erectile dysfunctions and so forth, it could be your testosterone levels are low. You could there are tests for that. You can go and talk to your doctor, and your doctor can probably do some tests. And if that's the case, a little bit of testosterone can help you. But you got to be cautious, just as other female hormones can cause cancer down the road. That can cause that too. So, of course, life is a balance. As you know me, I always talk about a balance. Something wins, something loses, and all that type of stuff. Well, I'll come back if you got a question about menopause, only you're feeling depressed about it, you're concerned about it, there's some questions you have about it and so forth. You can call me, 434-1771. See a good doctor, and OPP, other people's property, or other people, whatever, and naughty by nature, and I'll be right back. You stay away from PP, alright? Naughty by nature. Nice song, it's a big hit. Whew, I tell you, music gets your soul, man. I can't imagine myself living without music. And as a matter of fact, food for me. When I'm stressed out, I play some music, and when I'm down and out, I play music. So for every range of emotion, the music will do it for you. Get involved. Find some type of music you like and play it. And yes, don't try to find a way to de-stress in this world, So we talk about female menopause, we talk about male menopause. Somebody called me and asked me, Doc, erectile dysfunction and the stuff with Viagra and all that stuff, what should I do about it? That's a different program altogether. But I told them that there's some drugs that you can use. A lot of people who are hypertensive, and as a matter of fact, some of the drugs would cause sexual dysfunction and erectile dysfunction. So there's some that are very, very, very good, as a matter of fact, to increase blood flow to areas that would enhance your sexual function, like Diavan and Micardis and Atarax and those. A lot of those, a lot of receptor blockers. Your doctors can tell you about it. Increase the blood flow in those areas, and they're good for you. So you don't always have to go to Viagra and Cialis, because sometimes you have heart problems, or you have some medicines that really could cause death or even real problems. So make sure before you use those type of drugs, you consult your physician. How about those aspects of why we talk about male and females, those guys who take a lot of antigens? I want to warn you, somebody passed 2 weeks ago, because they were using a lot of anabolic steroids. Yes, it's good to look good and to lift weights and look strong and built and all those things, but do it the normal way. Eat well, healthy, good protein, fish and stuff, and nice food, a balanced diet, and then exercise. That's the best way. You will keep that way for a long time. When you try to get things quickly and use the steroids and so forth, you increase your risk of heart attack and heart disease and big hearts and early death. You see the wrestlers, you wonder why they die in their 40s. Why? That's why. They use a lot of steroids and predispose them to early death and heart attack. So guys, yes, it's good to look good with the big up chest and everything, and the nice musculature and so forth, and have the ladies screaming, but do it the nice way. Stay away from steroids. Heart attack. You don't want to see me. No, you don't. See me in other circumstances, but try to stay alive and live. Life is beautiful. I'm going for 100. I'm going to go 100 and plus. And I told my patients, and I tell them I'm going to outlive them. That is why I do the 5 miles every day, and eat the fruits and drink lots of water and get the rest as much as I can and stay away from the carbs and all those sugary stuff that causes your stomach to get a little bit heavy, which is associated with heart disease and cancer. My time is coming up. It's 9:26 on a Saturday morning, and you're here with the doc, thinking about life things. Remember the last time I spoke to you about that primrose that would help people with a hair problem? Another health tip for you. Your hair dropping out and breaking. Yes, we are not accustomed to seeing women bald and losing the hair. It's not extremely attractive, so primrose, you take one of those tablets, I think it's 500 milligrams twice a day, and then there's something called, go to the drugstore, linolenic acid has been shown to strengthen your hair and decrease hair loss. So yes, the hair is the woman's beauty. Use those tips, linolenic acid and primrose, morning and afternoon, guys, and see those nice brilliant gleam and glitter of the hair come back. This is your famous Dr. Sparman, and I'm here every Saturday morning, 9:30, to tell you the good news and to prolong your life and to make Barbados a healthier nation. We love you and we care for you, and have a nice day. Be careful on the roads. Don't drive too fast. Watch the red lights and so forth. And stop at the crossing for someone. Nice old lady passing by. We'll see you next week. I like Coolio, and Coolio is going to send me off right to my car. Gangsta paradise.
On Barbados.